Evening, everybody. My name's Chris Weiner. I think when I agreed to do this talk, my title was the Director of Public Health for Staffordshire County Council, but I went on holiday and I came back and a meeting had been levered into my diary first thing in the morning before the major meetings of the day started, and people turned to me in this meeting and said, Chris, we were talking about, changing the structures a little bit as time went on, possibly next April or so. Well, whilst you're away, we brought it forward a bit. So actually, as of today, I'm the Director of Health and Care within Staffordshire County Council. I know the world's going to change again, and we'll see how I get on in terms of permanent recruitment to these posts further down the line. But the world does change for us all the time, and I think that's really important for us to remember. And digital technology is actually part of that. It's a major part of the change that we have in our lives today. And for me, it does absolutely wonderful things in terms of improving my mental well-being. And so I'm sure all of you got sat-navs in your cars and so on. And coming here tonight, I was being guided all the way from Staffordshire down the motorways, down to this university, with Homer Simpson. Homer Simpson directed me left and right. Fantastic little voice to amuse me as I go. And got to the end of the journey. And Homer, he was great. He told me how fantastic I was, how brilliant I was, how I could hold my head up high because I'd got to the destination. So I did. I held my head up high, looked out over the muddy field and thought, must be pretty close, surely. So anyway, that's my journey here tonight, and I know there are other people who are probably having much harder journeys here. Some people probably turn up as the evening goes on. But now what I'd really like to do is take you back in time to the start of my public health career, which is really where my heart and soul is. So it was 1998. I just started my career in public health after many, many years working in hospitals, mainly doing anaesthetics and intensive care. And up until that time, I'd really spent my life picking up the pieces and patching together people's lives, and people hurt by such things as car accidents, drugs and alcohol issues, obesity, inactivity, and a whole host of lifestyle choices and issues. And I'd been looking after people with the impact of chronic diseases such as diabetes, heart disease, and things like dementia as it started to take its toll. And I'd admitted so many people to hospital over those years because it was no longer felt safe for them to be at home. Often these people were being kept at home, looked after by a tiring carer, somebody often older than the individual themselves with their diabetes or dementia, or occasionally somebody with no carer at all. And hospital wasn't the right place for them to be, and it probably wasn't the safest place for them to be either. But it was a place where they were admitted, and they were admitted there because we believed it was the safest place for them to be. But for so many people, the actual hospitalisation itself precipitated really a rather rapid decline in their health. You take these individuals out of their homes, put them into a difficult, noisy environment where sleep is hard to get, they get confined to bed, and early stage dementia gets unmasked. And people end up becoming increasingly confused, increasingly agitated, and far too often actually unable to return to the homes which they'd shared with their families for so long. And this was a really common tale. It still is. And it's actually an issue which I hadn't fully recognised until recently. Because I used to admit people to hospital as a junior doctor, and I used to think, as people came in through the front door, this individual isn't too bad, really. I'm not entirely sure why I'm admitting them to hospital. But, you know, my seniors and people around me say, no, no, this person needs to come in. So they'd come in with, you know, a bit of a urinary tract infection, a little bit off their legs, but generally looking okay as far as I was concerned. And 2 or 3 days later, those individuals start to go downhill. And I'd start to think, I was wrong, wasn't I? This person was a lot sicker than I thought. And 5 days later, that individual was really off their legs, very agitated, very confused. Dementia, which they'd been coping with at home, you know, in the environment where they knew, where they felt safe, was suddenly being very, very much unmasked. And far too many of those people I had to then see admitted to nursing homes, care homes, and some of them died as a result of their admission to hospital as well. Far too common an issue then, and still a common issue now. Anyway, it was 1998, and I'd just started in public health, and I was sat in a room of people like you are today, sat in a room listening to someone like me. And we all knew that the world was getting older, heavier, more expensive to care for and treat. We all knew that we needed to shift the world and start to prevent problems from happening. Shift the world and keep people independent in their own homes, their own communities, and shift the world and ensure that people were better cared for and better able to care for themselves going forward. We all knew at that time that we couldn't do this by ourselves, and we needed to find a way to work better together. But it was 1998. Yep, the internet existed, but it wasn't quite so pervasive as it is today. Mobile phones existed. I even had one. Text messaging existed, but it wasn't used as much today as it was used as much then as it is today. I think about that time, give or take a bit, the person owning the phone, sending text messages, used to send, on average, somewhere around about 1 text message a month. So things have changed quite a lot in that time. The iPhone and the app were still 9 years away. We all knew that the technology was coming, but we didn't really imagine or grasp how we might end up using it. And so I was sat in a room, like you are today, listening to someone like me, surrounded by people like me from a public health background or from a care background. I hadn't, and we hadn't, yet made the link to the world of digital technology and all that it could offer. But we have today, and that's the important thing. We have made that link. We are sat in the same room together, people from the health world, people from the care world, and people from the world of digital technology. As in 1998, we all know we can't make the world a better place by ourselves, and we need to find a way of working better together. But now in 2015, we really do have the opportunity to shift from the old ways of working to new ways that draw upon the skills, knowledge and experience of people in health, people in care, people in the world of behaviour change, behavioural economics, social science, and most importantly, digital technology. We now have the opportunity to reach out to people in their homes daily, twice or thrice daily if necessary, and, from my perspective, most importantly, to do this at scale. That's something that wasn't there, an opportunity that wasn't there to us back in 1998. Now, I want to take you to a different year, a different time, a slightly different place. It's the 14th of September, 2007. I wonder how many of you remember what happened on the 14th of September 2007. Well, I'll give you a clue. It's the same year as the smoking ban. And our fate is actually being laid out before us. And the reason for that is Northern Rock, on that particular day, sought and received what was called a liquidity support facility from the Bank of England to replace funds it was unable to raise on the open money market. And unfortunately, the age of austerity is upon us. Now, austerity is going to remain with us probably for at least another 5 years, maybe longer. The communities that we live in and serve are still getting older. The cost of care and treatment is continuing to rise, and the money we have to pay for it is getting harder to find. We still have to work together to ensure high quality, effective services for the people who need them. We still need, probably more so than ever, to work together to shift resources to the left, to prevent ill health and the need for care, to manage the demand for the services that our communities need. Now, this is recognised not only by me, not only by people in this room, but is recognised in things like NHS England's 5-year forward view, which was published in 2014. Those of you from the health and care world will recognise that actually that document has pretty much the same messages as the Marmot Review of 2008. And others of you may see the influence of the Simpson report that was published in 1998, right at the start of my public health career. I hope that everybody in this room recognises that it is absolutely essential that we shift the world to a preventative approach in order to deliver high quality, effective and affordable services to the communities that we all serve. You know, together we will need to deliver measurable changes in things like healthy life expectancy, the number of people actually living with a healthy lifestyle, and also the social and economic determinants of health, including such things as educational attainment, levels of employment and household income. Together, we're going to need to decrease the number of people in our communities with mental health concerns, including depression, anxiety and psychosis. Together, we're going to need to decrease the number of people living with the long-term impact of type 2 diabetes, heart disease, stroke, lung disease, and a whole host of different cancers. Today, we will need to decrease the number of children living their lives with long-term disability caused by preventable issues, joint pregnancy, in the first 2 years of life. Together, we need to increase people's ability to live long and independent lives in their own homes. You know, and I know, that we can't do this on our own. You know, and I know, that the journey is going to force us to come together, cooperate, collaborate, share, learn from each other. And you know, and I know, that we must take the communities that we serve along on this journey with us. I say this because recently I was in the United States and I was learning from the Veterans Association on how they'd rolled out digital technology to improve health and care services for their community. Their community was actually spread out over 10,000 miles in one direction, a few thousand miles in another direction. Very, very dispersed community. But whilst I was there, someone said to me, you know, Chris, the technology is the easy part. It is the people and the processes that you really have to work with. And they're right. The technology will come with all the fantastically clever people in this room today. The talk of a world of science that really, to me, is a bit more like a world of wizardry with its bits, its bytes, and its magical code. But what we need to do is to work on the culture around the technology. We need our communities to take responsibility for what is in their control and to help people to look after themselves and their children going forward. We need communities that strive to be independent. We need communities that are engaged in ensuring that our services are fit for the future. Now, I don't have all the answers. I have very few of the answers personally. The people in this room have more of those answers than I ever will. However, I do know that we're going to have to work together. And by not working together, we will harm the people in the communities we serve. By me not working with you, I'll end up harming the people of Staffordshire going forward. The 860,000 people that I'm responsible for in Staffordshire. So, if we are to ensure high quality, effective and affordable services for the people that need them, then we're going to have to change the way we think, the way we act, and most importantly, the way we design together. Thank you.